Recently, we were able to acquire a VitalStim machine through the generous donation of the Martinelli family. And the VitalStim machine is a machine used to stimulate the muscles required for swallowing. Typically, these muscles can be affected by somebody who's had a stroke or a brain injury. And this machine is a neuromuscular electrical stimulator in which we take the electrodes and put them together and put these electrodes on a patient's neck and allow them slowly to bring up the electrodes to present an impulse to the muscle belly, to get the muscle belly to contract, to allow the muscles to begin to learn to swallow again. It has to do a lot with cortical reorganization. And this is a machine that really helps traditional speech therapy accelerate the recovery time for people who are having difficulty swallowing.
When Erin had her stroke, obviously one of the things she couldn't do was able to swallow and not even be able to drink water. And this device can sense or find out, what's going on, whether the patient can actually take in water or food. Because for the longest time, all Erin's food was put in a blender, and even water had to have a thickening agent in it. And this device can evidently monitor all that stuff.
Historically, as speech therapists, we do traditional exercises to regain muscle movement. But they're typically very difficult for patients to isolate those muscles and really feel them moving because they are so weak. And by obtaining this neuromuscular electrical stimulation machine, it really has helped speed the recovery, especially on the inpatient side when people are so acutely ill and they have a lot of deficits going on. This gives them some direct treatment to give them the quick recovery that they're looking for and maybe be able to eat even before they leave here.
And that's when Beth said, we really need this apparatus, and I said, sure. So, and the amazing part of this whole thing is that it couldn't have been maybe 6 months after we donated this apparatus. My mom, who has cancer, cancer of the jaw and everything, she couldn't swallow food and everything, and she was put on that for testing, which was really nice. And two people in my life now has had the opportunity to have that and see how everything was going. Oh, a friend of ours who I worked with in Lisbon, who was there at the time that Erin had her stroke, and she brought flowers over the other day, and the carnations, there were 9 of them because it's Erin's 9th year since her stroke, and a rose on the top to make it 10 and keep going. It was very, very nice of them to do that. And we've had some really, really great friends and great support, through all this. And you need that. You really do.
From all of us here at Backus Hospital, we'd like to thank the Martinellis for their generous donation of the VitalStim machine that has helped many patients on their road to recovery for swallowing function.